Well, good afternoon, everyone, and welcome to Paws Off Those Meds, exploring veterinary drug diversion and prevention. My name is Madison, and I work alongside our wonderful COP-RCORP team. Before we get started, I would like to let you all know that today's session will be recorded and uploaded to the COP-RCORP website, along with the PowerPoint slides. And we would love for you to share this learning opportunity with others who were not able to attend today, and we will send the links along about a week from today's session. I would like to acknowledge the HRSA grant that has made this learning opportunity possible and would also like to state that the content are solely the responsibility of the authors and do not necessarily represent the official views of HRSA or the U.S. Department of Health and Human Services. Our agenda for today is opening and housekeeping, presentation, Q&A, and our closing and evaluation. For our opening housekeeping, for attendance, please enter your name into the chat. If you are seeking CEs, please include your license number with your name in the chat at the start and end of each session. You must attend at least 90% of the session and complete an evaluation within 2 days. Failure to provide required information or meeting attendance requirements may result in a lack of a CE certificate. And I would like to thank our participants, community partners, presenters, and planning and leadership team for putting this project together. Here you can see some of the wonderful members of the COP-RCORP team. So let's learn a little bit more about COP-RCORP. The Communities of Practice Rural Opioid Response Program is a multi-community consortium that includes the Pacific Institute on Research and Evaluation, PIRE, the Ohio University School of Leadership and Public Service, and 4 Ohio counties and partners. And these partners are the Ashtabula Mental Health and Recovery Services Board, the Fairfield County Adams Board, the Sandusky County Public Health, and the Mental Health and Recovery Services Board of Seneca, Ottawa, Sandusky, and Wyandotte counties. Each county has a community-specific consortium that leads projects and activities within the communities, and we are grateful to HRSA and all of our state-level partners that support the work of COP-RCORP. For more information about COP-RCORP and the work that we have done since 2018, please visit our website by scanning the QR code or copying the link you see here. All right, so we are going to play an ad for you all, and then I will give a little explanation afterwards. All right, so why are we exploring veterinary drug diversion and prevention? Well, our consortium first began exploring veterinary drug diversion after this GoodRx advertisement aired in April 2025. We began to wonder how this information may be used and perceived within the context of the misuse of opioid, gabapentin, and other prescription drugs. And we were particularly curious on the role of veterinarians in this conversation. And through that, our research led us to Putnam County's Paws Off Those Meds initiative, and that is a program specifically designed to combat the diversion of pet medication for human use. And we're thrilled to have Bill and Dr. Graves here today as they share their insights from Tennessee with our Ohio prevention community. Please remember to keep your audio muted during the presentation as we will have time for discussion at the end. Oops, no. There we go. I would like to introduce our two speakers today, Dr. Megan Graves and Bill Gibson. Dr. Graves is an associate clinical professor at the University of Tennessee College of Veterinary Medicine. For more than 20 years, she has also been operating as an after-hours field-based emergency clinician. Bill Gibson previously served as a police officer for 10 years and District Attorney General for the 13th Judicial District of Tennessee for 18 years. Bill has served as project director for the Middle Tennessee Methamphetamine Prevention Task Force and is currently the executive director for Power of Putnam Anti-Drug Coalition. All right. And I will now hand the presentation to our speakers.
Our veterinary consultant for the project that we're working on. And so I want to say a special shout out to my Tennessee crew today. I see so many familiar names. I just always love being in the room with you guys no matter where we are. And thanks for coming out today. And as Madison said, this is approved if you get your certificate, and you can use it for TCB certification hours. So this project is a collaborative that started in late 2019, and it involves several other collaborators. But Megan and I are the best looking of the crew and the most fun, so we got to come do the webinars. The rest of them contributed much to this, but we're sort of the mouthpiece today. So what we hope to do is just enhance everyone's understanding of this problem of diversion of medications prescribed originally for animal use. We want to talk about a collaboration that began here in late 2019 and went from community level to national level in about 3 years. Partly, thank you. If anything good came out of the COVID-19 epidemic, it was the fact that we had to regroup and retool our local project into something that would be able to be presented online, and it really boosted things. And then we'll finish up today by coming back at the end to discuss strategies that you could use to implement local diversion prevention projects, outreaches in your community. So by now, when we first started, this topic was not really well understood. There was some evidence, there was some newspaper articles, but there had not been a lot of study about it. We believe that there's greater understanding, both in the community and in the veterinary profession now. But I just want to ask a question, and this is kind of interesting. And if you can just put a yes or a no in the chat, or just send up a reaction. So just, have you ever had an animal that was prescribed a controlled substance by a veterinary for anything? So just put a yes or a no, or just send up a reaction. And I can't see the reactions, so I don't know how that's going to go.
Bill, I see a lot of thumbs up and a lot of yeses in the chat, and some comments that they're large animals only.
Yeah, so it's just interesting. We've presented this project to a lot of places around the country, and it's pretty astounding just in these groups, the number of people that have had controlled substances in their homes that were prescribed by veterinarians. It's a larger number than we expected going in. Second question is, have you heard of someone seeking to access controlled substances for personal use by utilizing an animal? And by now, I think that's probably yes. I think we've all heard of that. This diversion is a potential problem in every community, large or small. And the main question is, are there any ongoing local efforts to address it? And that's something we're going to encourage you today to do if you're not already doing it. So we're going to start off with a little activity, and this is just fun. We're going to put you guys for a very short period of time in a breakout room, a small breakout room, and we want you to put on your criminal minds, your criminal caps, because we want you to think what you would do in the town. So you live in a relatively small town in this scenario. There are 8 veterinary clinics. Some of them dispense and store controlled drugs on their premises. There are 2 clinics that offer mobile services, and you are in a struggle with opioid addiction. Prescriptions are becoming much more difficult to obtain due to changes in the law and the hard work of your local substance misuse prevention coalition. And drugs on the street are getting harder to get, and they're expensive. So you're part of a little group of 5 people, and you have heard that veterinarians keep a number of desirable controlled substances on their premises, and that they prescribe them for animals. So what I want you to do, and we're just going to take a very brief period of time to just kind of see what creative, good ideas that you guys can come up with. If we were live, we would give chocolate for the best ideas that are presented. We can't do that here, but When you get in your breakout room, just appoint somebody to report out, and instead of trying to come up with five things, maybe talk about different things and just kind of think of the one best thing that you come up with that would might work. Does anybody have any questions before we break out? Okay, so let's hear some of the good ideas you guys came up with. Somebody just unmute and tell me a creative idea that you came up with in your breakout room. I know your time was pretty short, but it's pretty simple.
Doggy daycares.
Doggy daycares. Good stuff. What else? Somebody from another group.
Working for the vets, a receptionist or an aide in any form.
Get a
Have
job
access.
in the vet's office. Excellent thoughts. Good criminal mind there.
Well, okay.
Somebody said they would start dating the veterinarian.
Well, oh, well, okay.
Okay. Anybody else have a good one that you want to
So our
share?
group, room 9, we said that we'd go to the next town over and adopt the oldest, ugliest, sickest dog from their SPCA and then doctor shop in the town that they live in.
That's very creative. And as creative as we are, the drug folks that are drug seeking can come up with even more and bigger ideas. Maybe one or two more.
Someone, I can't remember, I want to say her name, but she was talking about the mobile units and maybe robbing them,
Mhm.
Because they could be in more rural areas,
Yeah. And there's quite a few of those out there nowadays.
Our group, we talked about maybe somebody harming their pet and then getting a prescription for the pet, or stealing somebody else's pet and harming them, but just using the dogs as a route to the prescription.
Yeah. And we believe that does happen where animals are actually harmed and then taken to various, you don't have to stop with just one clinic. Okay. Thank you so much for that. And we'll move on to the next slide.
So can everybody hear me okay? Bill, give me a head nod. You hear me
I got
okay?
you, yeah.
All right. So before we hop into the issue of today, I just want to define a few terms so that we're all on the same page. And the first is, what is drug diversion? So here's drug diversion, and talking about how it's basically the misuse of a drug that involves unlawful acts in which the drugs are deviated from legal distribution into dispensing to an illicit market. And then the other term worth defining, which somebody already mentioned, kind of doctor shopping, would be vet shopping. And vet shopping is one that it's one of many means of acquiring drugs for misuse by obtaining an animal prescription with no intent of giving it to their animal. In fact, even if it is their animal, as some of y'all mentioned in some of your criminal mind ideas. So one of the many challenges faced in tackling this diversion issue is the lack of veterinary dispensing reporting requirements to a prescription drug monitoring database. About 70% of states do not require veterinarians to report controlled substance prescriptions. And even more difficult is that many veterinarians don't even have the authority to query many of the state prescription drug monitoring systems. In fact, of the 19 slides that were highlighted, 19 states that were highlighted on that last slide, in 34% of those states, the veterinarians don't have the authority to query the PDMP. And so even though they have to record them, they can't actually go in and search. So why do people shop at veterinary clinics? And you guys brought up some good ones already, but the big question really is, are the drugs for animals the same as the drugs for humans? And the simple answer is yes, because especially when it comes to pain relief in pets, the veterinary world really lacks products that are FDA approved specifically for use in animals, which leaves veterinarians to have to prescribe drugs that have been originally intended for the use in human beings when they determine a need for pain medications. So there are only currently 2 drugs on the market that are for veterinary use, and those are buprenorphine in cats and butorphanol for use in cats, dogs, and horses. But that's it. In 1994, AMDUCA became effective, and AMDUCA stands for the Animal Medicinal Drug Use Clarification Act, which outlines the provision for extra label drug use or using products not specifically labeled for a particular species or use. So to use something on label, the doctor must use the drug in the intended species. So I can't use something that is labeled for a cat and give it to a pig and that be considered on label. It also must be used for the indication on the label. So I can't give something to treat pneumonia if it's labeled to treat uterine tract infection. That would be considered off label. I can do it, it just wouldn't be considered on label. You also have to make sure that it is for the labeled route, so orally, IV, in the muscle, sub-Q. If I want to give it by a different route, that's considered off-label use. I also have to give it at the proper dose. So commonly we double the dose of dewormers in goats because there's so much parasite resistance, but then that makes that an off-label drug use. The last requirement is that you give it for the duration or length of time that it's prescribed for. And all of these things must align with the label requirements, or it's considered extra label or off label. And extra drug use means that you're going to have, in order to give something off label, you're going to have a valid veterinary client patient relationship. So after telling you that there are very few marketed opioid pain products for animals, you now know that when these products are given, A, they're likely given off-label, and B, they require a veterinary client-patient relationship, meaning that that veterinarian must have examined that patient with that client. So that's the reason that people have to shop around. The veterinarian must examine that animal to establish that relationship. So let's say somebody does get a hold of an animal prescription and decides to divert its use. Is that really dangerous? Well, let me see if I can convince you. So we'll start by just a couple differences between humans and pets, okay? So first of all, think about orientation. Humans are typically vertical, whereas animals tend to be horizontal. And why does that matter? Well, for starters, gravity helps move things through our GI tract much more quickly than an animal that would be horizontal. And although we know that people often look a lot like their pets, it doesn't change the fact that we are still very different. And so regardless of how much you might look like a bulldog or a Labrador, we can all recognize that our snouts are very different. And this is important because a lot of drugs cause respiratory depression, making the dosages different for brachiocephalic or smush-faced dogs. We also don't cool ourselves the same way either, or at least I hope you don't pant when you're running on a treadmill, because we know that drugs can alter the brain centers and they control cooling mechanisms, and so that can affect dosaging as well. So even more so than sweating or panting, what about the differences in our diet? Dogs tend to be carnivores, and that's a whole nother subject if we go into pet food. But because they tend to be carnivores, it makes their GI tract much more acidic, and they typically also have a shorter GI tract than we do as well. And so this can alter things like time-release drugs, as well as affecting urine acidity, which then alters absorption as well as elimination of drugs. So there are all kinds of differences that we could discuss, but there's a lot of variations in things like absorption and elimination. But there's a lot of other factors too. And one big one for me would be temperament. Okay, so pictured here are the Guinness Book of World Records, largest and smallest horses. Okay, if I had to sedate these two guys, I bet you would be very surprised at how little drugs I had to give to the one on the left, being a gentle giant, and how much I had to give alternative to the spawn of Satan here on the right. But here are a few other examples as well. So let's talk about a few. Tylenol or acetaminophen. It might surprise you that a small child's dose would actually kill a cat within hours because they can't metabolize it in their livers. What about aspirin? The half-life of aspirin, or how long it takes to clear half of the active ingredients in aspirin, is about 2 hours in people, and it's a whopping 22 hours in a cat. The liquid form of gabapentin used in humans, it contains a substance called xylitol, which is the artificial sweetener that is often found in sugar-free gums. Humans don't absorb xylitol, so it's no big deal that it's in there. But dogs absorb it, and it can cause extremely low blood sugars and potentially liver damage as well. So if I haven't already convinced you by now that veterinary drug diversion is dangerous, here are a few commonly abused drugs with their dosages, and let's just compare things. If we consider that the average human being in America weighs about 180 pounds, and we compare that with the average Labrador Retriever, that's about 80 pounds, to a 1,000-pound horse, then you can take a look at some of these differences. An average human being would be prescribed about 50 to 100 milligrams of tramadol for pain every 4 to 6 hours. Whereas a dog weighing nearly half of that would receive 145 to 360 milligrams every 8 hours. This means if someone got a hold of their dog's medication and they thought, well, I know I weigh about twice as much as my dog, I'll just take twice the amount of the drug, they're potentially giving themselves 6 times what their dosage would be. Ketamine is equally, if not more dangerous. Ketamine has a lot of usages, but in my world, as a large animal veterinarian, I use ketamine to anesthetize horses. So if I need to lay them down for a procedure like castration or a laceration or something like that, that's what I'm using it for. But it can also be used at low doses for like chronic pain and other uses as well. But considering that I lay a 1,000-pound animal down with this drug, people should obviously be extremely cautious. And it seems like even though this talk is about controlled substances, xylazine is getting a lot of attention. And it is not a controlled substance, although there's a lot of conversations circling about maybe making it a controlled substance. But I just want to mention it today as kind of an honorable mention because xylazine is super scary. This is an alpha-2, and alpha-2 agonists are very common, especially in my world as a large animal veterinarian. I literally use this drug daily. I frequently use this to sedate horses. I also use it to sedate small ruminants and cattle, but I use it very differently because ruminants are very sensitive to xylazine, as are human beings. And so they can easily experience overdose or death with an improper dosage. And so because they're so sensitive to xylazine, it actually comes in different concentrations. So you'll see this one bottle is a 20 milligram per mil strength, whereas the other is 100 mg per mil. And so people aren't likely to know that it has a different concentration. So again, knowing a little bit can be really dangerous because knowing a lot makes you very aware of how scary these things really are. And these are really just very few examples. So I'm gonna hand it back to Bill. Bill, are you there?
Bill, we'd love to hear you, but you need to unmute first.
Yes. So when we started this in 2019, it was intended as a community level project. We wanted to find out what was going on with about 8 local veterinary offices. There was not much study on it. There was a lot of newspaper reports that were coming out around the country that actually involved people injuring animals and taking them to different veterinary offices. And it was a collaboration with Tennessee Tech University. And the coalition people on here know that we live on partnerships, and we have a great partnership with Tennessee Tech. They wanted to maybe even study the problem in these local 7 or 8 offices. And so what happened, COVID-19 came and kind of set back our live access, the ability to go see people and take resources and do live classes. And we took it to an online course. And as part of that online course, we gathered data. But one of the earliest kind of warning signs several years ago was data that came from the DEA, ARCOS, which is their automation of reports and consolidated orders system. It tracks controlled substances from the manufacturer to the ultimate sale, the final sale, or being dispensed in hospitals or whatever. And what they noticed was that there was a lack of decline in opioid prescription among veterinarians when it was really declining among human physicians. And so that was kind of an early warning sign that something was going on. And so the survey data indicated that a lot of veterinarians had observed, believed, or suspicious of that they had had cases of diversion within their practices. They had seen something that made them think that it was going on. And then most of them were very concerned about the problem. They felt like they did not have proper training in prescription drug misuse, and they desired more education. And that's one thing that is part of this project we have been able to provide, and something that if you want to do a local project or a bigger project, that's kind of the centerpiece, is providing education to them and understanding on what the problem is and some best practices that they could utilize when they do see it come into their practices. So I expressed the need for some sort of database to track animal prescriptions. So far, that does not really exist on any kind of large level. And there's just no governmental body that tracks crossover use of veterinary medicine or diversion of medicine. So we decided to kind of gather our own data, because once we got this online course rolling, we got it approved locally, statewide in Tennessee, and then the surrounding states surrounding Tennessee, and then it went nationwide. So we had kind of a captive audience to gather some internal data. We got 61 respondents. There was a great variation in their size of practice. Most of them had over 10 years of experience, predominantly small animal practices, but all sizes of communities, and 70% treated emergencies.
So most of our respondents said that they dispensed controlled substances to clients. And when they were asked in an average week how many prescriptions they would do in a week, it varied greatly, with some of those practices saying that they only prescribed 1 to 2 controlled substances per week, but there were some that said they were prescribing more than 100 prescriptions for controlled substances in a week's time. And the veterinarians also reported that they'll write prescriptions for clients to fill at offsite locations as well. But unfortunately, despite those high numbers of reporting that they do dispense controlled substances, more than 90%, they don't even offer a simple disposal. As if you don't finish using your drugs, you can bring them back and offer simple disposal. Most of them did not offer that at all. And when we explained vet shopping in the survey and defined it like I did for you all earlier, we found out that about 90% of our respondents had heard of vet shopping, and at least 75% thought that they had experienced it firsthand in the past 3 years. Additionally, 25% thought that someone had purposefully injured an animal to receive pain medications. And when we asked them if they thought there was a problem in their community, we found that as we expanded the area, that percentage became more. So 36% felt like it was a problem in their local community, whereas that number grew to 52% in their region, and then 70% thought that it was a problem nationwide. We also asked the veterinary community about the types of controlled substances that they were prescribing. And the most common classes were the serotonin modulators, things like trazodone and gabapentin. And more than 50% of our respondents reported prescribing these drugs daily, with synthetic opioids like tramadol being a close second at just over 35%. When we asked those respondents about education on the matter, about half of our participants claimed that they had never received education or training on the prevention or management of vet shopping, despite the fact that 75% said they've maybe experienced it or they have clients that ask questions about the use of animal medications in people. Disappointingly, more than half reported that they do not talk about the potential abuse of veterinary medications with clients, and the overwhelming majority don't even provide simple handouts about the subject either. So this means that this is a world ready for you to tap into because they are not out there doing anything on the prevention side.
So what this rolled back to was an online, on-demand continuing education course, which is now approved for 2 hours of credit in all 50 states through RACE. And there's 7 modules, and each module is presented by topic or subject matter experts on that particular topic of the module, and here's a QR code that will take you to a registration page. The best way to understand what this course is it's free. It's just to go register and take the course. And it's a better understanding of the overall problem of diversion than we can present here just in this limited amount of time. But you can see what the modules are there, and hopefully you'll get an opportunity to take a look at the course and see if it's something that you might want to promote to the veterinarians in your area. So it is approved, as I said, in all 50 states, and it's not the entire project, but it's the centerpiece for local outreach. Offering a free 2-hour continuing education is a pretty popular door opener for your animal practices. And it's along with that, you can provide all sorts of resources. You can make as big or as small a project as you want to. Lock boxes, office signage, all the things that go along with kind of an outreach project. So recently, in late 2024, we decided to bring it back to the local level. COVID had diminished, and we're able to get back live with people. So we acquired some Tennessee Opioid Abatement Council funding and started projects in 15 Tennessee counties. And a lot of you guys are on here today, and thank you so much for the excellent work. We don't have time to tell you all of the people that have been reached. As of today, about 1,500 completions of this course have taken place, and that's just a lot of outreach. So along with continuing education, as I said, there's stickers for prescription bags, informational brochures for the office, signage for waiting room and treatment rooms. And these are all things that you can develop and provide for these offices. Also, outside signage, sometimes they'll want to have signage that no controlled substances are maintained on these premises. I just have a few slides that kind of highlight some of the resources that have been developed by our Tennessee coalitions as part of this project. These are just a few representation of the hundreds and hundreds of outreach resources. And this is a t-shirt Cannon County came up with. And the Opioid Abatement Council loves seeing these walking messaging billboards going around. So this is just some great work that's been done. For the coalition people, of course, we all know our funding kind of hangs on connecting what we're doing to CADCA's 7 strategies for community change. And without going too far into this, I will say, you can read the slide, but I'll say that this project checks all of those 7 strategies in multiple ways. So if it's something that you wanted to apply for funding or weave into some funding stream that you have or a grant application, we can talk to you about and we can give you sample implementation plans and talk to you about how it connects with the 7 strategies and the funding streams that we all love so much and hopefully still have. So in the end, we wanted to see, and I know we have a very diverse audience on here from several states and several professions, and we wanted to give it just an opportunity briefly to share what ideas that you may have that you've come across or that you've learned to prevent diversion in veterinary medicine. And this would be just an opportunity if there's something you'd like to share with the group, just to unmute and share your thoughts on what can be done. And Tennessee folks, I know you've got field experience putting some of those thoughts into action. So if you've had a success story, you could weave it right in here. Don't be shy. Okay, well, if nobody has anything any burning thing that you'd like to share, we would take an opportunity to take questions.
Bill,
Sorry,
I
Bill.
see
Yeah.
that- Oh, I
Go
see
ahead,
that
Al.
Jane says we provide med locking bags.
Yes, that's very good. It's interesting because it's kind of a two-pronged thing. We want to educate and support the veterinary profession, but we also want to educate and support the community and the animal owners that will have these medications, on the same. We want them to treat these medications the same way they do controlled substances prescribed for humans, which includes safe, secure storage and secure disposal.
Thank you. Jinx also says medication disposable pouches. Jinx, do you put stickers or special signage on those, or how does that look?
Not as yet. Just have like a little postcard size informational thing, along with a data prepaid postcard to come back, but I'm looking at stickers and expanding.
Absolutely. Thank you.
I know some of our coalitions have had animal medicine specific take back events. And just very creative things like that.
I see Hazel's put in the chat, give a history of how long pet has been in the home. So Hazel, do you want to unmute and give us a little background about why that strategy has worked for you?
I was just thinking the idea was, what are some thoughts on preventing it? So if veterinarians required a history of the pets being in the home.
Yeah, that's always a challenge because we do always take a history and gather the information, but you're relying on that human being attached to that animal to give you the history, and they can make it whatever story they want. And it can be Snoopy that I walk in with right now, and I've owned him for 5 years, and then I can go just down the road, and all of a sudden this is Scruffy. And I've owned him for blah, 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 because it's really challenging when we don't have requirements for permanent identification on a lot of these animals. So we have to take the human beings at their word. And so that's where the prevention really falls on making sure that we're prescribing things that really need to be prescribed, and then taking other actions in educating people on the dangers of it. Because unfortunately, trying to identify the animal and crack down on making sure that it's really that animal is really, really challenging to do. Do you guys remember in the movie Annie where she just found the stray dog? She'd known it for 3 seconds, and then she's trying to prove to the police officer that it's her dog, and makes up a name. Come here, Sandy, and she starts calling the dog. I mean, in that instant, she'd only known that dog for I don't know, 10 minutes or something. And then she was able to call that dog to her and make it look like it was her dog. And so we can't really rely on the history as much as we would like to.
Right.
But if we had other ways to permanently identify animals, that would be amazing. Like a microchip kind of system that was mandatory.
Too bad paw prints aren't unique, Megan.
I'm sure they are, but go ahead and put that into a database.
And then there's also a comment in the chat about needle disposal. Would either of you have comments about needle disposal?
So some take back events, it depends on local regulation, but I know some take back events will take sharps and others won't, but there's usually most of our coalitions have found ways that they can get those disposed of.
And Megan, from your perspective as a vet, if you have a diabetic cat who needs insulin injections, what's that conversation look like with you about needles?
Yeah, so in the state of Tennessee, well, first of all, I would never work on a cat. That's absolutely terrifying. I would take a 1,200-pound bull any day over a terrifying cat. But in the state of Tennessee, you can dispose of needles in, like a laundry detergent bottle, and then drop those off. And so that is something that veterinarians talk to owners about when they come in, and you can sell sharps containers and they can turn them back in. There is a fee for that, and so you've got to try to figure out how you're going to manage the fee for taking those on if you're going to turn those needles into the state.
Absolutely, thank you. So we'll move to last call for questions for Megan and Bill.
So guys, keep our contact information, and if you are interested in starting a project, get in touch with me. And the course, I meant to tell you, the course is currently approved for registrations through November and completions through the end of the year. So we hope that it will be reapproved and be available for 3 more years. But if you want to outreach some vets and maybe promote the course a little bit, at this point in time, I would advise them to just go ahead and take the course or go ahead and get registered for the course as soon as possible.
Absolutely. And we have one last question. For the states successful with veterinary PMDPs, are they connected to human PMDPs? For example, if a pet owner is receiving a controlled substance for their dog, is there a flag or anything like that that shows the person is also prescribed that medication personally? I'm not thinking because of confidentiality, but just curious.
Yeah, I am not aware that that is the way that works. And so a lot of times with the veterinary ones, we wouldn't be able to see that from the veterinary side. So I honestly can't tell you because we don't have the ability to search those to see what their human attached to that pet would be prescribed. But that's where we need some of that at a higher level to be able to do that. But no, I'm not aware of anything like that. It would be a great, Ashley, why don't you make that happen through the legislature? I would love to see that happen.
Thank you. I'll hand it off to Madison, who's going to park this bus for today.
Thank you for your time today, folks.
All right, well, such wonderful discussion. Thank you so much. And what's next here? Well, today's slides will be posted on the COP-RCORP website approximately 1 week. And if you enjoyed today's session, please consider viewing a replay of our afternoon insights exploring xylazine misuse and prevention webinar that can be found in the link below. All right, and for closing housekeeping, for attendance, please enter your name into the chat. Again, I said this earlier, but if you're seeking CEs, please include your license number and your name. And you must attend at least 90% of the session and complete the evaluation within 2 days of the session. And that leads into our evaluation survey. I would like to thank our partners for making this event possible and allowing us to offer CEs across various disciplines in Ohio. And you can scan the QR code here, or we will drop the evaluation survey link in the chat. And after you've completed the evaluation, you can log off, and that concludes our presentation. Thank you.
Can you put that back up, please? Are you able to put up that QR code again? Because
I'm going to put it up again. I'm just going to pause and put the link in the chat, and then I'll get it right back up.
Okay, thank you.
No worries. I got your back.
Okay, thanks. Yeah, I'm trying to take a minute to get my license number too. 6-1.
Absolutely. Thank you all for giving us the information we need to be sure that we get you the credits you need to.
Okay. Thank you.
Absolutely. Once you have completed the evaluation and have signed out in the chat, you may log out for the day. We really appreciate you joining us. We know you have a lot of choice in continuing education, and the fact that you chose this event really means the world to us. We appreciate it.